So before you were licensed and went to medical school, is surgery something you knew you wanted to do from the start?
Going to medical school, I definitely wanted to do some kind of surgery. I didn't know what it was. I actually thought that I might want to do cardiac surgery or orthopedic surgery. And it was actually my senior year in med school that I did a rotation in plastic surgery just kind of for the fun of it, and just fell in love with it. It's such a diverse field. One day you could be doing, a facial reconstruction. The next day you could be doing some cosmetic procedures. The next day you could be doing a reconstruction from a cancer. So it's such a diverse field that really drew my interest.
Now, before we talk about how you helped me, you do both reconstructive work as well as cosmetic procedures here. Could you tell the viewers the difference between those two fields?
Sure. I view a cosmetic procedure as taking somebody who is normal and wanting to improve their appearance. So that would be a cosmetic procedure. A reconstructive procedure, I'm taking somebody who either was normal or never normal, maybe has a congenital problem like a birth defect, and just making them as normal as possible. So that's what I view as a reconstructive procedure. Very different.
Absolutely. And I'm going to add a few overlapping photos so you guys can see the before and after work, but I really had a noticeable deformity here that you did a fantastic job of fixing. We went through 2 procedures and one more touch-up to go. I know that a lot of these details are almost incomprehensible to people like us who are not surgeons, but can you try and explain to the viewers how you went about fixing that corner of my mouth, and the injury took place from a dog bite for those who do not know?
Sure. When you had this injury, there was a lot of things that happened. It wasn't just the skin and kind of the external problems that you noticed. It was actually a lot of muscle damage. And so there's a lot of intricacy in the oral muscles. There's a lot of different muscles in that area. And when the dog bit you, I think he tore through a lot of those muscles. You were originally fixed, so the laceration was repaired. However, I don't think those muscles attached themselves properly. And so I think you subsequently went through a lot of scar revisions. And that was kind of, in my view, a little bit for naught because of the fact that the underlying problem was still there. Those muscles were still in the wrong position and attached in the wrong places. And so what I did was I went back in there, unattached all of those muscles, and then rotated things into the proper direction, reattached those muscles so that they align your lip in a much more normal fashion, similar to the opposite side.